welcome Denise Kapulka from Knights Airport Limousine, who is here and been on the show in the past. Welcome, Denise. John Cygielnik, a driver for Knights, and welcome, John. And Patti McKone, who's also, I think, joined us here on the show in the past from the American Cancer Society. Well, welcome.
Thanks.
Well, Patti, maybe you could give a viewpoint to our viewers in terms of the American Cancer Society and what you do locally, Worcester and Central Massachusetts.
Sure. We well, actually, the initiative that we're doing now with Knights Limousine, Denise and I had actually met at a chamber event, so it's kind of a nice tie-in. But it's about one of the focuses for the American Cancer Society is on prevention and detection. So the earlier that people get their tests, their screenings, all that sort of thing is all that much better for for their outcome. Healthy lifestyle, all that sort of thing is a big focus for us in Central Massachusetts. We have a lot of different events, and then we also run Hope Lodge in Worcester for cancer patients to stay for free while they're having treatment.
And Hope Lodge is where?
Right off of Elm Street.
Elm Street,
yep.
Right. And that's where families and kids can go, where people go with their...
It's just adults.
Adults,
but,
okay.
They can stay while they're having treatment for free. Yeah.
Right. And Denise, you mentioned how you guys met at a chamber event, but so much of what we hear from employers, certainly one of the top issues is health, wellness in the workplace. What employers can do proactively in that regard to help kind of keep healthcare costs within budget. What is it that caused Knights to kind of jump in on this?
Well, we actually do a lot of giving back to the community. We have done ataxia research, we've done Carry the Falling Rock, and then when I met Patti at the chamber event, we decided to try to figure out what we could do together. Guess the networking at the chamber works out well. So we came up with this. For the month of September, our drivers change their uniforms, so they go from our typical red shirts and ties to now blue polo shirts with the American Cancer Society ribbon and blue ties. And then they also give out brochures to the passengers that are on board.
And the idea is just to try to raise awareness, to reinforce what Patti said, detection, prevention, people being proactive and getting screenings and things.
Correct. And we have 140 drivers. Typically 90% of them are male. So even if we can raise awareness to the 120 male drivers that we have, we're doing our job.
And John, this issue, not only as a Knights employee is relevant, but on a personal level, it's something that you have experienced and been through.
Yeah, I was detected with cancer, prostate cancer in 2005, and basically went through the operation, and things have been good. But Knights helping to be in the forefront, I think, you don't think about it, and a lot of males don't like to go to the doctors, but through a sequence of events, I was doing annual checkups, and that's how they caught it. They caught it very early, and basically, I'm fine now. Right.
And we were talking earlier with Jerry Alderman about City Square and Mercantile Center, one of the first companies that jumped in on that new project several years ago was St. Vincent Hospital with the new Cancer and Wellness Center, and that's a state-of-the-art treatment.
It was. I want to say I was very early on with at the time, new Da Vinci machine. I had Dr. Blute as my urologist, and I think I was the 6th person that used the machine with him. So there probably only had been 15 or 20 people that had used that machine at that time. But, once he gave me that option and looking at the alternatives, I mean, to me it became a no-brainer to use the machine in the equipment.
I mean, doctors working with robots, and providing quality care. And St. Vincent, I think, has been recognized nationally for some of their work in cancer. And Dr. Blute, obviously a legend locally.
Yes.
Patti, so this is, around prostate awareness and working with men, but your efforts are year-round.
Absolutely, and it's not just prostate cancer, but I think that the thing that we sort of like about this focus is that I think in October it gets that pink focus of breast cancer awareness, and it's a kind of a nice, almost lead-in, but it's sort of the flip side of making sure that that men are aware of, check in with your doctor, get that checkup, that type of thing, be proactive with your health,
And just some of the statistics I know, talking about men, the percentage of men or breast cancer. I mean, there's I think some data out there about if you're able to get those screenings, reducing
Oh,
Yeah.
absolutely, yeah. And prostate cancer is the #1 cancer for men,
Right.
so it is important for people to pay attention to that, yeah.
And customer reception to this, John, as you talk them through this process?
Customer reception, I'm not sure.
As you know, you're handing out brochures and
Oh.
talking to people about
Yeah.
this, or you're driving, yeah.
Yeah, you know, some people want to talk about it, some people
Yeah.
shy away from it, and I guess, you know, that as a driver, you don't try to force yourself on the customer.
Yeah.
But, you know, going back to my situation 11 years ago, I think, as they say, awareness nowadays, you know, it's much more out in the forefront in terms of being awareness. There really wasn't that type of situation back when I got cancer. I think, you know, between things like prostate, breast cancer, and melanoma, it seems like that's out there an awful lot to get screened, to get checkup, and things like that. And I mean, my comments to anybody listening would be, you know, get yourself checked. It doesn't hurt to get checked. Get your annual physical. I mean, my story is through a sequence of events, I happened to see a doctor. I didn't have a doctor, so I was healthy. When I was 41, I had an incident on something else, and I had a ruptured disc. Okay, so I had to see a doctor.
Yeah.
But basically, he said, you know, after 40, you should be getting a checkup every year. Well, we went through 21 years of you're fine, go home, and then the 22nd year,
Right.
it was kind of an something's wrong here.
Yeah.
You
Yeah.
know, and so it just happened, and they caught it very early, and I've been very lucky.
That's great. That's great. And Denise, you know, Knights, as you mentioned, employ a lot of people, provide an important service. It is talk about kind of health awareness and kind of getting involved with your employees. This is just one of a number of things that you guys do year round.
Yeah, we do a couple different fundraisers. We've done the Cancer Walk for UMass, which is this weekend, this Sunday. It's coming up. So we've done those. We do the Ataxia Walk, which I forefront that along with my catering partner, John Morrow. So him and I do that, and we take the veterans to the Carry the Fallen Rock. We've brought people to 9/11. We've done a lot of different fundraisers throughout the years.
Right, right. Well, I think it's a great example of what our chamber member businesses do. You know, when you look at a lot of the great things that are happening in the community, you know, supporting organizations, you know, individuals, philanthropy. Oftentimes, I notice that it seems like so many of our chamber member businesses are at the lead, and that you know makes we try to get the word out. But it's you know why it's so important to have good locally involved businesses. So, I want to thank you for joining us on this segment. And
Yeah,
this isn't the
having
first. I'm sure everyone will be back. And John, thank you for joining us and sharing the story.
Yeah.
You're welcome.
Good.